Well, good afternoon, and thank you very much for having me to be here today. It's interesting that I'm a physician, but the Latin term for physician is physic, and actually he got it right. So thank you. What I want to do today is basically sort of cover some aspects of stem cells, what we're currently using it for, and what we plan to do, what the future uses of stem cells are. And I will describe different types of stem cells and try and explain that for you. The title of my talk is Stem Cells for Life, because I think many people ask the question, well, is this something for us today, or is it something for the future? And there are so many reports and articles coming out about the use of stem cells. And what my objective today is to kind of put that in perspective for you, because I'm both a researcher as well as a treating physician. And I started my career in Scotland at one of the premier or top stem cell transplant programs. And we have pioneered the use of stem cells for treating diseases. And so the disease that we pioneered the use of stem cells for, and we pioneered the use of the individual's own stem cells to treat patients who had life-threatening illnesses. So I want to discuss that with you today. It says your health and your life, and I will emphasize the importance of that as well. I am going to need someone to help me to So this is just a little bit of information about us. The Institute, the South Florida Bone Marrow Stem Cell Transplant Institute, we have 15 years of experience in the field of totally outpatient stem cell transplantation. We're a joint commission accredited facility. The traditional use of stem cells, the approved use in the United States, is for the use of high-dose chemotherapy and stem cell transplantation. We also have a collection and cryopreservation facility, which is accredited by the American Association of Blood Banks. We're a research facility too, so we also have ongoing clinical studies for different diseases, and I will describe some of those too. This is what the Institute looks like. It's on the ground floor. Bethesda Health City is a complex, 16,000 square foot complex, and we are located there. So I want to start with a story, and the story is about a patient who, named Louis Masucci, and he was sent to me about 4 years ago he was actually referred to me by a friend of his. Now he had been diagnosed with a condition of cancer called non-Hodgkin's lymphoma, and he'd been struggling with that for over a year. He'd been to see many doctors. He'd been to see at least 5 oncologists, and each of the oncologists had said to them that basically you don't have more than 2 or 3 days to live. So that's when he was basically when he came to see me. And when I saw him, he had, if anyone has seen a patient with cancer, this was classically what it looked like. He had disease everywhere. He had disease, and it was called a non-Hodgkin's lymphoma. This is a cancer which affects the lymph nodes. So his lymph glands everywhere were swollen. His liver, his spleen was swollen, and his abdomen was extended. It looked as though, his wife describes it as though he was like 9 months pregnant, because he had so much disease and so much fluid in his lungs. This is a picture of him on the left. This was taken this was taken about 2 months ago. And he and his wife, they live in Lake Worth. And over a year, I was able to treat him, to be able to shrink his cancer, but at the same time rebuild his immune system. And he's completely free of his disease now. He's in what we call a molecular remission. That means we cannot find any evidence of the disease. His quality of life is good. He's back to normal, and so he enjoys. His greatest thing is that he likes to bring us food, because his wife is an excellent cook, and so whenever he gets the opportunity, he would like to bring us food, and that's his way of saying thank you. So I am going to try and put that all in perspective. What did we actually do to help him?